Hey, Dr. Pejic.
Hello, Ashley. How are you today?
I'm good. Do you have any trips for traveling with your medication?
Yes, I have 4 tips if you're traveling with medication, managing your medication. Um, Travel stresses people out, so it's an important thing to talk about with your doctor. The first step I have is uh, for patients taking Adderall or patients taking benzodiazepines like Xanax or Klonopin, those are controlled. They may need a doctor authorized early refill. Now, these medications are not often refilled early because they're controlled. The way that works is you only get 30-day supply, and about a day or two before you run out, you're supposed to refill your medication. The problem is, what if you travel on day 15 and you're going to be gone for 3 weeks and you're going to run out of medication when you get to your destination, like during your trip, in other words. So what we do here is sometimes we'll call and again, these are patients in good standing that we know take their medications responsibly. We will sometimes call the pharmacy and have them do an early refill, but we have to actually verbally call them to do that. It's not usually something we can do digitally. On top of that, the patient needs to be warned that their insurance may not cover the medication since it's already been renewed. So they're going to have to be coached in preparing to pay cash for their medication if the doctor is going to allow them to do this. So they go to the pharmacy, they may need to use a GoodRx app to help defray any cost if it's expensive. But usually things like Adderall or Klonopin are they may cost between $10 to $30, depending on how much somebody has. So that's the first tip. Second tip I have would be never assume that a doctor can call your medication into a different country or even to a different United state. So if someone's in France and I've been contacted before and said, hey, I need a medication, they are blindsided by the fact that there's no recourse. I can't call the medication into France. So it's important to talk to your doctor about getting enough of a supply to cover you while you are on your trip. Also, there's a couple states in our union that will not allow a digital prescription out of state, and that would be California and Texas, from what I know. Sometimes New York is a little finicky about it too, where the doctor cannot call in stimulants like Adderall or Vyvanse or Ritalin. So if somebody's going to those states, they need to have a plan on going there. Some states will not let you call in benzodiazepines like Xanax, Klonopin, or Valium, where they have special rules about it. So what I coach my patients to do sometimes is say, hey, call a pharmacy in another state and ask them about the rules in that state and what's allowed and what's not allowed, or identify a pharmacy close by to where they're staying so that they already kind of know the situation if something went wrong. And aside from that, the fourth tip I have is for folks who get travel anxiety, and that can look like having a panic attack on an airplane or on a train. Or there's folks who get kind of claustrophobic while traveling and they can't sleep, and so they need help sleeping on a plane. So the tip is to get travel anxiety medication. Those types of medications might be something like a Xanax or an Ativan, or it could be something like Vistaril, which is a strong antihistamine. And then there's sleep medications that sometimes folks will take when there's a sleep period to a trip. So if you're going abroad and you have a 14-hour trip and some of that overlays your sleep cycle, then sometimes we'll authorize a medication for that time. But we got to be careful because we've all seen movies where, what is that movie with Kristen Wiig where she's like totally zany on there and either she drank too much or she took something. So, and this is a very serious topic. They have patients need to be coached on whether or not they can take the medication on a flight. And the second thing is, it's good to do a test run prior to getting on an airplane of how one is going to tolerate that medication. So you don't want to prescribe Ambien to somebody and tell them to get on a plane and they've never taken Ambien before. You don't want to prescribe Xanax or Ativan for them and they've never taken that ever before. It's usually my patients who those medications are in the mix already and they use them as needed responsibly. And then I'll say, okay, this is how you would take these medications while on the flight. Again, important point, you got to talk to your own doctor about this. This is not medical advice for anybody out there specifically. So very occasionally, I will use something like propranolol, which is a beta blocker, which helps someone like who has nervousness, or if they tremor, or if they get a high heart rate, or if they have some social anxiety and they get nervous, but they don't want to take something sedating. Sometimes we'll use propranolol, which is really kind of a social anxiety medication. It's also mainly used as a blood pressure medication. And again, it requires an expert psychiatrist to make the call on this. The last tip I would say would be if you lose your medication abroad or in a different state and your doctor can't call it in. So say you're in France and you're 7 days into a 12-day trip and you're on 1 milligram of Klonopin at night. I tell patients a couple things. Number one, identify ahead of time a pharmacy nearby that they could go to. Number two, identify perhaps a hospital nearby or a clinic that they might be able to go to, or even call the concierge at the hospital or at their hotel prior to going and ask them the question, what do I do if I lose my medications or if I need medical help? I'd gather that information. And if they lose their medication while they're trying to find some of this information out, I coach my patients to sometimes ration their meds so they don't abruptly stop it. Because if you abruptly stop something, you can go into withdrawal. This can happen with Effexor. It can happen with Lexapro. It could happen with an anti-seizure medication like Lamictal. It could happen, obviously, if somebody's taking Klonopin or Ativan. So sometimes, and again, it's not specific medical advice, but sometimes it's better to take a half dose and stretch it out a little bit while you're getting emergency care. So there's that. Another way I find helpful for patients to prevent them from losing medication would be to keep 2 bottles of medications and keep them in 2 different locations, one in like a purse and maybe one in their luggage. So if somebody was robbed, they still have some in their luggage. If their luggage is lost, they still have some in their purse. So sometimes that can be an effective approach. I had somebody one time told me they were using the bathroom and they had their luggage in the stall with them, and while they're going potty, someone swiped their bag from underneath there, and they were out of all their medication for the whole trip. And that was like in the airport before they left, I think. So do look out for that. And the last thing I wanted to mention is sometimes certain countries require you to have a letter with a treatment plan. I believe Japan won't allow certain medications. And so sometimes what we'll do is write a letter saying that somebody has a diagnosis and this is their medications they take, plus the bottle with my name on it and the patient's name on it. Sometimes I just print out a treatment plan that says a diagnosis and the medications, and I hand that to the patient for them to take with them. But one should probably look at the country that they're going to and make sure that they know what the rules and regulations are in that country. Rest assured, most countries have these medications available. Some of them have less regulation. For example, I think clonazepam, lorazepam are found in the pharmacy sometimes without a prescription. It's an odd thing because they're controlled substances here, but sometimes not controlled in other pharmacies in other countries. Yes, France has Prozac. Hong Kong has Prozac. So most places, South America, large like Buenos Aires, things like that, will probably have all the usual medications. If you did lose your medication, there's probably some recourse. Or you can take something that's very similar to that medication to offset withdrawal symptoms, but a doctor at that local place should be able to, or should be the one to tell you what that medication would be. So those are the 4 tips. So doctor authorized early refill. Number 2, never assume that a doctor can call any refill into Texas or California out of state or to another country. The third thing is prepare for travel anxiety with maybe an as needed medication. And then the fourth thing would be to plan for if you lose your medication, that you have a plan in your mind of where you would go for that.
All right, awesome. Thank you, Dr. Pejic.
You're very welcome.
So I know this is kind of the unsexy, unglamorous side of planning for travel,
Right.
but it's really vital to have a good trip.
Absolutely. And you want to feel good on your trip abroad so that you can have fun and be happy.
All right. Thanks, Dr. Pejic.
All right. You're welcome. See you, Ashley. Bye-bye.